everyone. I'm Megan Culp, along here with Scott Micklin.
Good morning. Good to see you. I think they mean hello.
I mean...
I'm sorry. I think our technology has failed.
Yeah.
I don't believe that is the correct greeting that we wanted to share this morning.
I mean, for our radio viewers, listeners, because
Yes.
you don't view the radio. For our radio listeners, it just says...
It's okay. We can't say it. You can't even say it on the radio.
Yeah, you can. Really?
No, you can't. Come on.
You just can't use it as an insult.
No. All right. Okay.
Anyway, it just says hello.
It should say hello.
I wish it said, oh, hell.
It should say
be funnier.
hello. And hello to you.
And hello to you. Okay,
Viewers,
I gotta regain my composure here.
Please.
Okay.
Here we go again.
Okay.
It's like we've never stopped laughing since yesterday.
Well,
we really need to.
I mean...
Come on.
Yeah.
If you didn't see the end of yesterday's show...
Well worth your time.
That's one for the books.
It is.
Yeah.
See, I still have this
fun.
very... I mean, it's shooting for the sky. It's a pie in the sky, I think, pipe dream, about, like, having a like, sort of anthology of blooper reels and stuff. Like,
Right.
I just feel like it would be hilarious, but I also feel like maybe it would just be hilarious for us.
True.
And maybe not the general public.
Right. That's very true.
They'd be like, it was embarrassing the first time, guys.
Yeah. Why would you even remarket that?
replay this?
Yeah. But anyway, here we are. So, good
Thursday.
morning, everybody. Thursday the 25th. And here we are, week 14?
15.
15 now.
We just finished 14.
Did we? Mm-hmm. Okay. If you say so.
I know because of Radio Free Saturday Morning.
Of course you do.
Yeah.
That's Saturday morning. Day
9
after
to
tomorrow.
11 a.m.
Day after tomorrow, everyone. Megan Cullum. So, you got a
More
theme
of
for this week?
Compassion, I think.
Oh, nice.
Yeah, I know. Shaking things up.
Okay, I like that.
Yeah.
Okay.
It came from a Prince quote that I saw yesterday.
Oh.
Compassion is an action word that knows no boundaries. Brought to you by Prince.
I like that.
Right?
Yeah, that's very nice.
That man was deep.
Yeah, he really was. So anyway, on the show today, everybody.
Yes.
Speaking of deep, and I'm not, on the show today, we're going to talk to a nurse practitioner about the COVID to home clinic that Sound Health Partners is offering and how patients are recovering. So I think that's going to be
that's important.
Good to hear from. And also businesses, again, the Chamber of Commerce in Farmington is asking businesses to fill out and answer questions on a survey about how COVID-19 has impacted their business. So Jamie Church from the Chamber is going to be calling in today on the show and talking with us about that. So we have all that to look forward to.
Yeah.
Exactly. That's
excellent.
True. So yeah. But we'll get started with some of the numbers. And we talked yesterday about, that some of the numbers had seen kind of a spike in daily numbers in San Juan County. And there was confirmation. Of course, the story was there are now positive cases at the detention center. And so those numbers were added to the regular numbers. And so that's why we see more than we normally would have seen from yesterday.
Which is a substantial piece of information. So it's 32 of the 41 new cases from the detention center. Not that that's not a big deal, but that's a very helpful clarifying piece of information.
Exactly. Very true. So you've got the national numbers.
I do. The national numbers. As of Wednesday night, 2,380,490 cases of COVID-19 have been reported in the United States. We've now seen the most daily cases that we've seen yet. Was the New York Times report, and that number was an increase of 33,553 from yesterday. 121,969 deaths have been attributed to the virus, which is an increase of 745 from yesterday. And this all comes from the Johns Hopkins University COVID-19 dashboard, and we've now conducted so many tests, 28,567,355 COVID-19 tests. Of course, this is the active virus test. So not antibodies. That's just talking about the active virus test.
Right.
And we still have, the mortality rate's gone down, 5.1%.
Very good.
It was 5.3 yesterday.
Okay.
These are, of course, they seem to be movable numbers as information rolls in.
These daily numbers kind of go up and down. So there you go. We've got good morning is safer than hello.
Yeah.
So there's that.
Good.
But yes, good point. And those daily numbers are, that is kind of the problem with looking at these numbers every day because we don't get the averages.
Right.
Which would be a little bit more over time. But we're going to look at some local averages right now because we have the numbers, everybody. So we thank San Juan County.
I also got a live fact check on the air.
Oh, pardon me.
Yes,
go ahead. What
Devin
do you got?
Neely from the county, who also is responsible for updating these graphs.
Yes.
Said actually 30 out of the 41
were detention center
Right.
numbers.
The other 2 had already been reported.
Thank you, Devin,
Thanks,
for
Devin
that.
Neely.
Thank you very much.
Yeah.
Nope, that's important. So
It is important. Thank you.
appreciate that. So there you go. So here we are on ksje.com, everyone, and we are looking at the numbers. And so we want everyone to kind of take a look at those. And this is what what we have at the moment. As we scroll up, we can kind of see in New Mexico we had 156 new cases yesterday. In San Juan County, we were back down to 14 from 41 the day before. 4 additional deaths in New Mexico, so that's now 480 people who have lost their lives. And one of those was in San Juan County, so that number is now at 155 here locally. Recoveries were up by about 110, and so again, that is worth noting.
Yes.
So we appreciate those numbers. And as we scroll down a little bit more, there are the specifics, and we can see the Navajo Nation numbers again updated last night. Now 69 new cases there, but 11 more deaths on the reservation. So that's a bit of a jump from what we've seen earlier in the week. And they are now at 7,157 cases and 347 deaths on the Navajo Nation.
Right.
So there is that. 11 more cases in Montezuma County, Colorado, but that's since early June. So those numbers are certainly not as big as what we've seen elsewhere. And still 2 fatalities in Montezuma County, but no additional ones since early June.
Cool.
So there we go about that. And I'll come back to us for just a moment as we scroll up and take a look at some of the get to the county numbers. And again, they have been doing these averages, which is why we like to share them with you when they are updated for the viewers to kind of see the bigger picture. And
it is very helpful.
It is.
Yeah.
And so we
It's
appreciate.
like when you zoom out.
Right.
It's like a drone view of the numbers.
Right, because every day we see these ups and downs, and they're sometimes concerning, sometimes not. But when you see the average, you can kind of see maybe a trend of what's going on and what's coming. So we can go back to that and show you kind of where things are looking. So here are the total cases that ended on June 23rd. So these are daily, and you can see those numbers, right? So the pink is the state of New Mexico. Radio listeners, we encourage you to watch on the video on YouTube or Facebook. The dark blue is total San Juan County numbers, and the green is Navajo Nation numbers. So again, we can kind of see at a glance day by day what's been going on. As we scroll through the other charts there, we can now see some of these as well, right? Come on, website.
Technical difficulty.
There is a total cases, and now we're going to go to the next one. There we are. These are the San Juan County cases again, so we can see the blue number are the total San Juan County cases that spiked yesterday.
Yes, it did.
That we can see.
Right.
And the yellow line, which is barely visible there on the bottom, are the daily deaths, right, associated with COVID-19. And then we'll get to the averages here as we go to the next slide, and we can kind of see that. So these are the cases per 7 days, right? So again, dark blue is San Juan County. The pink magenta is state of New Mexico. And the kind of lime green would be the Navajo Nation cases in San Juan County.
Right.
So there we go. Those are those.
Helpful.
Right?
We do see a plummet.
Right. Everywhere, which is good. We want that. That's again the averages, which we want to see. And then the final one we want to show you real quick, and then we'll move on, is this fourth slide, which are the, again, COVID cases every 7 days. And again, these are new COVID cases, and then in the blue in San Juan County, and then the deaths in the yellow along the bottom there. But those new cases, again, you can see that from the peak every 7 days in the hundreds, a couple hundreds, 200, 300, down to maybe less than 50.
Right.
Every 7 days, which is helpful.
That is helpful.
That's the trend. So there you go.
There you go.
So thank you, San Juan County, again, for updating that graphic. We find that very helpful. So thanks, Devin. So there you go.
Shout out to you, Devin.
Shout out.
That's 2 shout outs to Devin.
Exactly, very much. So we can go to the phones.
Yes.
And talk to our first guest this morning, who is joining us on the telephone. Good morning. You're on KSJE. Thanks for calling in.
Yes, this is Rebecca French.
Hi, Rebecca. Thank you for being with us. Rebecca French, nurse practitioner, again, with San Juan Health Partners. And you are working, of course, with the COVID to Home Clinic and doing a lot of telemedicine. And so we've seen just some of these numbers about cases hopefully decreasing in the county. Hopefully you're seeing that as well, and your colleagues seeing that as well at the hospital. Hopefully that's true. You can agree with that?
I can agree with it somewhat. It's kind of hard for us to determine based on the COVID to home numbers, just because there's been some changes in how we're receiving patients now. So Are you there?
We are here.
Oh, okay. I thought I lost you. So I do feel that overall that our numbers are either dropping a little bit or maybe staying the same. So
that's good news. I have a question that may or may not be relevant or easily answered. So heads up.
All right.
I mean, it's relevant. Okay. Anyway,
Just go ahead.
I'm just going to go ahead and get to the question.
Okay.
So I have a question about Remdesivir, because that's been in the news recently as a possible treatment, which has apparently been around a while as like a broad spectrum antiviral, usually injected in the veins, but that they're using it as a nebulizer so that people can use it at home. I'm wondering if you know anything more about that, as you are an expert and I just curate things from the internet.
yeah, so Remdesivir is a medication that is being used, and it's mostly used in the hospital settings. We are not using it on an outpatient setting during our, in our COVID at home clinic, or even patients getting discharged with that. So for our area, it's strictly being used as an IV medication in the hospital, and you have to meet certain criteria in order to receive the medication.
Very good. Thank you. And so, Rebecca, with these patients that you are working with now, these are folks who have maybe been hospitalized and then are being discharged to continue their recovery at home, and that's kind of where you step in to kind of monitor them and see how they're doing and those types of things. That's what this COVID to home program is all about?
So, yeah, there's actually several different ways. We monitor not only patients that are discharged from the hospital from COVID, but we also monitor patients who are positive with COVID or have COVID-like symptoms that do not require hospitalization at that time. So what it really is patients, whether you get swabs with New Mexico Department of Health, with an outside organization like healthcare organization, or with your employer, if a person was to come up positive for COVID-19, then they could call our we call it C2H clinic, or our COVID to home clinic, and basically enroll themselves into the clinic without any referral needed. The number actually for this clinic is 609-6284, and they just simply have to say that they tested positive for COVID-19, that they were sent home to recover from it, and that they want to be enrolled in the program. And so we monitor patients that way, as well as discharged from the hospital. The way that we monitor people, of course, is through telemedicine majority, but we also can do phone calls if they don't have the ability to access video. And so we interview them, like they will see a provider via telemedicine, and then we stratify them into a category of low, moderate, or high risk, depending on their medical conditions, if they have diabetes, heart disease, if they're immunocompromised, things like that is what we look at, as well as age. And if they're high risk, they're going to get a telephone or a video visit with us every single day for approximately 14 days, as well as a nurse phone call during the afternoon, in order to make sure that they're not deteriorating. So that's the high risk. The moderate risk and low risk work a little bit differently, not as high frequency in calls to those patients, but there's constantly a provider that they can get in touch with, or that will reach out to them every day while they are at home.
Very good. And so, Rebecca French, talk to us a little bit about how long these folks are maybe in the program. I know every case is different, of course, but we've heard some of these things that even for folks who've maybe recovered from the coronavirus and COVID-19, that they still have some effects, maybe some decreased lung capacity or some other lingering effects. Even though they are relatively healthy and deemed recovered, their bodies may still have some issues. Is that an accurate thing? Are you seeing some of that in our local patients?
Of course, yes, we are. So our average, because we do keep track of this, the average time frame that a patient is in our clinic is approximately 16 days. We have patients who are actually discharged maybe, 10 days out to 14 days, but there are patients I've actually followed that are 30 days out from, their actual diagnosis of COVID-19. They may be requiring oxygen or, other they've been on antibiotics and just a lot of different complications that COVID-19 can have. So unfortunately, it's not as simple as, I got COVID-19, I'm going to recover and get back to baseline. A lot of things that we are seeing is injury to the lungs, and we're not quite sure exactly what the post-COVID patient's going to look like, because we don't have a lot of data right now on that. I mean, we're learning this just like everyone else is, and we're trying to get as much information as we can. Again, we have like 6 months of data right now, just because this is such a novel virus that no one has really ever seen. And we are, like I said, we are seeing some scarring to the lungs. Patients who never required oxygen before are now requiring oxygen, and they're not getting off of it as easily. Patients who have COPD, it makes it worse. And so if they, again, weren't requiring oxygen but had COPD, they're now requiring it. So we're seeing a lot of neurological side effects too. A lot of patients who may be ending up with blood clots throughout their body, blood clots in their lungs. So there have been some cases where patients are, unfortunately losing maybe a limb or, just some complications of COVID-19. So it's not this benign or virus. We're dealing with something very severe that we've seen, a wide spectrum of symptoms. So anything from very mild, very like almost no symptoms to very severe symptoms, including death.
Wow, we were just sitting here kind of amazed at the things that you were talking about, Rebecca French. And with these patients, are these mostly older patients? Are they middle-aged patients? Are we seeing some of this in younger patients too? Is there anything you can tell us about kind of that part of the recovered patient?
Again, it's such a varied range of patients. We don't have any really good markers on who's going to do terrible with COVID-19 versus who's going to do well. Some patients I've taken care of, they're 65, they have a significant history of, cancer and some other medical problems, but they do great and they have no problems whatsoever. Whereas a 21-year-old who is healthy, really has no past medical history, ends up in the hospital and discharged with oxygen. So it's a wide range, and I cannot, unfortunately, I don't know who the person is going to be that's going to have mild symptoms versus someone that's severe. Because the minute I feel like, someone's not going to recover or do well with it, they do fine, and the person I thought would do fine is actually needing hospitalization.
Yes, that's what I had heard, that different immunities respond differently. And is it possible, I mean, some of this seems to be related to just now we've had enough time to track people and see what's going on. Is it also possible that this virus just continues to mutate? I mean, the last time we talked to you, you mentioned the COVID toes, which I have not removed that image from my head yet. It's like very I don't know how fast it's evolving or anything like that. Stuff that I've read, it doesn't appear that it's evolving very quickly, that it's pretty stable right now. There may be some small things, evolution and stuff, but, it's not seasonal. We've now learned that, it is still happening during the summer months, and it's not slowing down. So I can't really answer that one in particular, but as far as I know, it hasn't changed very drastically. Now, some of the things that we are seeing more of right now, though, is a lot of nausea, vomiting, diarrhea, sore throat. So I don't know if that's more along the lines of, the seasonal change it may have, or I can't really answer that with 100% confidence. Sure. That was super, super helpful, though. I mean, because in the beginning we were like, oh, this affects the lungs, and now it just sounds like, oh, like every part of your body, I mean, I guess the body is a total system, but now it just sounds like many, many things can break down. So, again, this might be something that takes some time. There might not be any new information on it, but there's been discussion about does a person have continual immunity? And it seems like a lot of these people, don't go home to a house where it's just them living there. So is there some concern about that?
So, we haven't seen a lot of people getting reinfected with it right now. So that is some, confidence. But again, we don't know how long the immunity is going to last. So you probably will have some immunity, but we just don't know the time frame, like how high those levels need to be. We don't know if someone that has a milder case of COVID-19, if, the immunity they get from that is going to be effective to prevent them from getting it again. There's just a lot of variables with it. But, there are people that are getting antibody testing. So there's a lot of new things that are coming around. So we can get more information on how the immunity is going to last. But I have seen some patients where, if they follow the strict guidelines of isolating themselves versus quarantine, self-isolation, you're actually removing yourself from being around your family, around anyone that could get COVID-19. And those people, usually are infected with COVID-19 and have to self-isolate. If you properly do that, your family is at lower risk of coming up with symptoms if it's done effectively. I've also seen some people who, have previously been, had COVID-19, and then maybe, a few months later, some coworkers and stuff get exposed, or, their family gets exposed, but they end up not getting sick from it. So I have seen that a couple of patients have been in that situation. So that's a little comforting.
Yeah, that's super helpful. And you had mentioned the antibodies test briefly, and I was wondering if there's any more guidance on who should get antibody tested, especially since there's been some like false positive, false negative. You get a false positive, and then you lose your vigilance, and then there's a whole other issue there. So you have any thoughts on that?
I honestly haven't looked at the guidelines for the antibody testing yet. I do know that it's around, and I feel that different organizations or different places that are doing it might have different guidelines for it. But I do know it's out there. There are some places that, even if you have never had COVID-19 or you don't think you've had it, they're still doing antibody testing. So there's kind of a wide range of how people are doing it right now.
Very good. Well, Rebecca, we appreciate your time this morning and calling in. Thank you so much.
Yeah, thank you.
Thank you very much. That is Rebecca French. And again, would you mind, Rebecca, sharing that phone number one more time before we let you go? I'd hate to have folks not know how to get in touch with you.
Yeah, so the number is 505-609-6284, and that's our COVID to Home clinic. They can call, and just ask to be enrolled in it, and then we will get them enrolled. There's no referral that's needed. And one other thing I have to say is if everyone could just please wear a mask. There are studies now that are actually showing that it is slowing the spread, so it is very important. If we want to get through this, then we all need to be wearing masks. So I wear one to protect you, you wear one to protect me.
There you go.
Yes.
Good advice. Thank you so much.
All right, thank you.
You're very welcome. That's Rebecca French. She is a nurse practitioner with the COVID to Home Clinic with San Juan Regional Health Partners. So we appreciate her time calling in.
Absolutely.
And
always
interesting
so
information, right?
Yeah. When she said neurological issues, I was like, neurological issues?
Right.
I mean, there's just like these new things.
You don't want to mess with this thing. You really don't.
Clearly, yeah. And that's her point about masks. I mean, it's so simple. It's a minor inconvenience.
Right.
The more I'm suspecting that just like everything else we do in life habitually, the more that you wear it, the less you're going to notice it. But another thing I've just noticed all over the place is that you got to cover your nose too.
Yeah, please.
It's the same. Air is coming out in both, and it's the same respiratory system. You don't want the droplets. Maybe if you can really just close your eyes and visualize how gross it is.
Oh, thank you.
That droplets can be flying out of your. I'm just trying to. Sometimes you have to be graphic to like get people in line. But the mask thing is. I mean, I get riled up about it. Rightfully so.
Yeah.
So
no, I know it seems a little selfish to not
It's a lot selfish. I mean, you wouldn't like go around and sneeze in somebody's face, right? So I think we need to put it in the same category as social norms.
Right. Well, and I don't think people realize that when we just speak normally that we are expelling
100%
stuff.
Yeah.
You know, not just words and voice and
it's an
air.
aerosol disease,
Anywho.
which makes it,
Right.
you know, obviously we know it's highly, highly, highly contagious, and that's why, because those aerosol droplets can even hang out in the air when I'm like down the road from you.
Right.
So I think let's put it in the same category as social norms when it comes to what you would and would not do as it pertains to rudeness. And it's just rude.
Yes.
Wear your mask.
I know.
Anyway.
True.
All right.
I agree.
Rant over.
Thank you.
In this episode of What Makes Megan Angry This Morning.
Right. Exactly. that's the short list today.
There's
More.
exactly. There's no that
more.
running list.
That's okay. But there you go. We have another guest scheduled to call in, but she's not yet called in. So
Cool.
She hasn't called in. So you have something else that we can
Is this like
about.
share the interesting
It could
story
be. Share the
time?
interesting story time. Yeah.
Cool.
Do you have one?
I do.
Okay.
Always.
Is it about llamas?
No.
Is it about
I haven't heard anything recently about how winter's doing. That was the name of the specific
the llama? Right. Interesting.
So.
Is it about toes?
No.
All right.
I mean,
I'm 0 for
we
2.
can talk about Plato.
I'm 0 for 2.
But I'll wait on that because there's The Economist. You know how I love all things economics. And I've been really thinking, like, why do I love all things economics? I think it's just like the most logical, rational study into human behavior, and that's just fascinating to me. But so there was a special report on how various plagues throughout history have impacted basically economies post the plague as it pertains to individual workers. So I know that was like a really convoluted sentence. So basically, right, the bubonic plague, vastly different because it's not respiratory. It wasn't respiratory at all. If it's a bubonic plague, which still exists, it's passed through breakings in the skin. So a flea might bite you. You know, you might have a broken skin thing, and it might. So it's not pneumological, which would be through the air.
Yeah.
Your lungs, like pneumonia, right? So that is different. But what they found is that after the plague, of course, Europe lost, millions and millions. It's amazing they ever even recovered their culture after that, if you think about it, just all the things that could have been lost. But that the peasants it was like everything came up peasants after that. You know, peasants traditionally had a terrible life, basically, and you were submissive to the landlord. But then so many people had died off in the bubonic plague that all of a sudden there was a high demand for peasants, and you could basically barter and say, you know, I want the equivalent of benefits. Like,
interesting.
I want a day off to go make my mead or whatever. Whatever they did.
All right.
Back in the day. I need my day off to read my Chaucer.
Things got a bit more democratic.
A little bit more. There was this like sort of negotiation with salary almost.
Right.
So,
whereas before it was just, you work for me.
Before it was like there's tons of peasants and good luck to you. You'd be glad that you have anything.
Yeah, you have a dirt floor and a hut.
Yeah, exactly.
And you're welcome.
Yeah, exactly. You're welcome. Yeah, kiss my signet ring. Yeah, exactly. So then they talked about the Spanish influenza. Okay, so that's more recent history. In fact, very, very small number of people in the world today actually experienced it.
Well, it was 100 years ago.
Right, so you had to be, so slim amount of people, but still, they exist. And the big difference that they were pressing there is, yes, so much of what's happening is similar. Yes, we're scared about the second wave. But what is so different and what is so related to what Rebecca was just telling us is that we know things now. So it's not just that the technology, they didn't have respirators back then. That's a thing. Mm-hmm. But, even we have a limited number of those now. But it's that we have this information that we know. We know it's respiratory. We know, I guess they knew that back then. But we know about aerosols more now. We know what we can do to stop it. We know about physical distancing. We have the ability to physical distance because we live in bigger homes generally. And it's like, and that goes back to the wear a mask thing. You're worried about the second wave, which has happened in the past, but we have knowledge now. Knowledge is power, so they say. And so I agree with. And so it's like, we can do things now, guys. Like, we're not totally a victim of circumstance. As much as this illness came upon us in a way that we would never hope for, and as much as this illness is still mysterious on some level, a novel virus, and as much as treatment is still developing, and we really just have these kinds of almost like we're always kind of playing a game of taking a crapshoot, right, as far as what treatment's going to work for this person and what treatment's not. But when it comes to having agency here, we have it. And I just think that's really, really important. The peasant thing was interesting, but I think the thing that we can take home and apply is just how much agency we have in this disaster.
Right. True.
So,
and even though we don't know a lot about this, and our knowledge is evolving, right?
Yeah.
What we do know is useful.
That's right.
And helpful.
That's right.
To
So
be
we
able
can't
to
just
control the spread and,
Yeah.
and again, kind of be responsible.
Yeah, do your part, because we don't need to just rely on better science this time. We can rely on better science and the knowledge that individual citizens have.
Right.
So,
There you go.
again,
I like it.
soapbox, but there you
Thank
go.
you for that. Thank you.
So, and now look, I filled up enough time that we have a next caller.
Look at, see? Good job. There you go. And you get talked about peasants, which I know is one of your favorite topics.
Serfdom. I have a soft spot for serfdom.
But there you go. Oh, nice.
Oh.
Well, let's go back to the phones
Cool.
then and talk to our next
Cool.
guest. Good morning. You're on KSJE. Thank you for calling in this morning.
Good morning, Scott. Thanks for having me. It's Devin from San Juan County.
Hey, Devin from San Juan County. How are you?
I'm well, thanks. How about y'all?
We are doing well. Thank you for the live clarification earlier this morning. We
Yeah.
appreciate that.
Fact
And,
check.
Yeah, glad to.
and so talk to us a little bit about what you wanted to talk about, or you just wanted to call and say hi. That's fine too.
Well, Jamie Church will touch on this when you get her on the phone, but I wanted to mention that our GIS department has built a repository database and map for folks, businesses that are reopening, to post some information about what their reopening looks like, if they have changed hours, if they have some different requirements, if you're going to be in their store, and you can find all of that on our website. That's at sjcounty.net, and there's two slashes. sjcounty.net/open is the map, and if you are a business that wants to be listed with that map, sjcounty.net/weareopen. And there's already a number of businesses that are listed there, but if you'd like to put your information on that list, we would love to have you at it.
There you go. Very good, Devin. Thank you for sharing that. That's great.
Yeah.
And it's open to any business in the county, correct?
That is correct. Yeah, anybody that wants to post their information, we have just a smattering of different types of businesses up there so far.
Smattering.
And,
Devin.
No.
You know how I love the language.
Yeah.
yeah, we know.
There you
Yes, Megan.
He's met both
the
of us.
town knows.
go. Devin has met both of us before.
Yeah.
So there you go. Perfect. Well, Devin, we appreciate that. Thank you for sharing.
I certainly will. Thank you for getting that information out, and you guys have a great day.
You
You
bet.
too, Devin.
You too, Devin. That's Devin Neely from San Juan County calling in to our COVID information program. He sounded a little out of breath. Maybe he's doing some crunches or something.
Yeah, because he loves the abnormal times we're in.
Maybe that's true. I don't know. But it's nice to hear him.
It is.
I'm glad he called in. So
Should
there
we
you
explain that? It's kind of an inside joke. We should probably.
Is it?
Abnormal?
Yeah.
Well, Devin made a funny
He did.
last
No,
night.
he did. Right.
On the Facebook.
Yeah.
About-
On your Facebook. I think
Right,
it
because
was,
I
right?
was
So
talking.
now- yeah.
Yes,
He's
because I
now
was
hung
talking
up.
about the platonic forms.
He's now hung up.
And talking about the good, the true, and the beautiful. And then Devin
Right.
comes on and he says, "I'd prefer to call it the new abnormal we're in."
Right.
Not that I'm referencing my abs. I think
Yes.
was more or less the
So
paraphrase.
now his
of it.
abs are subject to
Yeah.
conversation.
Yeah, you did this
And
to yourself,
speculation.
Devin.
That's right.
Uh,
Anyway.
I have the survey up. Do we want to just briefly touch on that and then?
Well,
do?
we can mention that I think Jamie's not available this morning. So,
Right.
but the Farmington Chamber has launched its third
Yes.
business survey, and they are asking for folks to fill it out and to answer questions about how their business has been impacted by COVID-19. And you have the survey there. You're
I
looking
do.
at some of the questions.
Just some of the questions,
Yeah.
yeah.
Okay.
Just to further the point that this is for any and all businesses, because
Mm-hmm.
there's quite a list, tourism, automotive, construction, sales, leases.
What business are you
furniture.
in? What's your area
Right,
of business?
right.
Sure.
So, and then you can obviously list other too. And have you been able to reopen for business following the New Mexico Department of Health guidelines for safety and occupancy? And if not, when do you anticipate opening? Very helpful information.
Right, good to know.
And what's been the biggest obstacle in reopening?
Okay,
Very helpful.
right.
If you if you're open for business, do you feel, and this is very interesting, the same as before the shutdown, less than the before the shutdown, and more than the before the shutdown, as far as how your business is doing.
Okay.
And have you been able to rehire people?
Right.
Are you currently spending money to market and advertise? Do you need assistance with any resources such as face masks, hand sanitizing, staff safety trainings, etc.? So
Good to know. Yeah.
that's going to be an efficacious survey. So seriously, if you're a business of any type, please fill that out.
That's right. At the Farmington Chamber of
Help us
Commerce
help you.
website, you can
Yeah.
find the link there and go check it out and fill it out. And again,
right.
they've been doing this pretty regularly during this whole
They have.
pandemic. So and you're able to kind of
Stages.
compare the answers to see like how businesses are feeling about being able to reopen, or if they're able to reopen or hire their people back, or whatever the case may be. So we appreciate the Chamber taking that initiative to ask these questions and
do.
compile the answers from their
That's
members
right.
and others.
Keeping our commerce going.
That's right.
Yeah.
So
Very
there-
important.
So there you go. Very good. Well, that brings us to the end of the show.
Yeah, fun times.
You know, we talked about
Serious times.
peasants and serfs and toes.
Chaucer came up.
Yeah.
The
Abs.
Platonic forms came up. I mean, we really...
We've covered
the gamut.
Really have.
We really have. Oh,
That's
we
true.
should remind them about next week's change.
There's a change.
There's a change.
Yeah, that's true. Next week. So because things are kind of reopening,
Yes.
we have decided to maybe do the show on 2 days a week and not 4 days a week.
That's right.
We'll still pack it full of local
Oh,
information.
yes. Quality program.
And great guests, but we'll be here with you Mondays and Thursdays, 9 a.m. live on Facebook and YouTube. But again, you can hear it on the radio at noon still on KNM on Mondays and Thursdays, and here on KSJE 5:06 p.m. Mondays and Thursdays.
Right.
So
Mondays and Thursdays, same time, same stations,
yes,
but
Mondays and Thursdays.
Mondays and Thursdays.
That's right.
So that'd be good.
So Tuesdays and Wednesdays, you're just going to have to maybe look at our pictures. I don't know.
Look at our pictures.
watch a archived show. But I think
Yeah.
everyone will be okay.
I think we'll be just fine.
Okay. I mean, we've gotten messages that people are going to miss us, which I appreciate.
I so love that.
I think that's very sweet.
I so love that.
But
Yeah.
we'll be here. So you'll get Scott and Megan Fix twice a week.
That's right. And don't worry, because we're just going to pack more. So
Yeah.
you might hear 3 stories about peasantry during the Middle Ages.
That's true. You may do that.
We don't know.
Yeah. But it's very free-flowing, the show.
We really do.
Yeah.
We've just let the stream of consciousness gate completely
It's
open up,
like time.
which is
Flows. It is. Yeah, that's true. Anyway, our goalposts are on Mondays and Thursdays now.
Oh my
So
gosh.
anyway, there you are, everybody. Thank you for watching, everyone. Wash your hands. Don't touch your face.
That's right.
And we
Wear
will
a mask.
see you, and wear a mask. And we will see you back here on Monday at 9 a.m. Bye-bye.